Palawan, Philippines, globally renowned for its stunning beaches and vibrant tourism industry,
has unfortunately faced high rates of teen pregnancies and a significant surge in HIV cases over the years.
Roots of Health was established in 2009 to confront these issues head-on. Since its inception, this nonprofit has positively impacted thousands of women and young people's lives. Roots of Health achieves this by equipping them with crucial health information and providing free, non-judgmental, high-quality contraceptive services and HIV screening. The organization has also built a network of trained volunteers and government partners, including village health workers and public school teachers, who play vital roles in increasing access to essential information and clinical services. There has been encouraging progress with a recent annual decline in teen pregnancy rates in Puerto Princesa City. This is a testament to the efficacy of Roots of Health's programs and interventions and its dedicated commitment to its vision. A Philippines where everyone is empowered to exercise their sexual and reproductive health and rights, free from stigma and discrimination.
I'm Susan Evangelista, and I'm the founder of Roots of Health. It was my idea to start Roots of Health. I was getting so concerned about students I had who had gotten pregnant and had to drop out of school, and just I could see they didn't really understand reproductive health at all. I was with a friend who wanted me to do an evaluation of a little boy. While we were in the family house where this child lived, my friend found under a protective screen net a little wizened up, almost mummified baby, maybe 3 months old. It turned out was the child of a college student. The mother had not been able to feed the child properly, and she was starving. This is really a problem and really something we might be able to influence somehow.
My mom had this idea to start an organization that would focus on trying to prevent teen pregnancy. My husband Marcus and I were living in New York City, and I had just finished a dual master's degree program in public health and international affairs. With Marcus having experience as well in teaching, it just all clicked together, and we were so excited by this possibility, and we immediately said yes to my mom.
When we ask them, anong mga nalalaman yung gamot pagdating sa STIs, they say na, kailangan mo lang uminom ng bleach.
Nauuna po na magkaroon muna ng anak bago po sila maghanap ng kaparaanan pagdating sa kontraseptibo.
13 years old na nabuntis, and yung isa pang 13 years old na namatay dahil sa HIV.
What I've really found shocking is that over the last several years, the number of HIV cases keeps increasing, and there doesn't seem to be much urgency to try and prevent young people from getting HIV.
So I thought education is first.
Women said to us, okay, now we understand how contraceptives work. Now we want access. We had to partner giving people knowledge with access to free, high-quality, non-judgmental clinical services. And that was the point when we hired our first nurse. For a while, we just had that two-pronged approach. But we recognized that in order to really be sustainable, we had to bring along our government stakeholder partners.
At Roots of Health, we're data-driven. We like to look at the data, try and see what that is telling us. We also, of course, like to speak with our government partners and, most importantly, people on the ground, so that we can make sure that we're getting a complete picture before going ahead with new programs or changing directions with existing ones.
Pagdating ng 2022, the funders really offered to give us multi-year grants. So I think that's a big tell of how trusted and how confident yung mga funders namin.
Yung Ugat ng Kalusugan po, isa po sila sa tumulong sa akin para mag-provide po ng vitamins, mag-provide din po ng mga contraceptive injectable po kasi yung sa akin.
Kami po yung talagang nasa community na nagbahay-bahay
para ipaalam o ipaabot po sa kanila kung ano po yung serbisyong meron ang ugat ng kalusugan. Kami naman po talaga yung una nilang nakakausap po.
Some of also our educators, they're not that open-minded in regards to the delivering about sexual education. The Roots of Health help us in changing that stigma. We are really, really grateful for delivering the best kind of education to our learners.
Roots of Health, they complement what we lack. Teenage pregnancy namin ay bumaba. That can be validated by the PSA result do sa registry ng Civil Registrar. We were awarded way back 2018 as the best implementer ng RPRH. Last year, we received 3 awards: Best Population Office, Best Innovative Project ng LGU. I was given the recognition also as the Best Population Officer ng region. Hindi namin yung makukuha without the help and support. And isa sa mga partner stakeholders I can vouch for that is the Roots of Health. We felt na hindi kami nag-iisa.
Gagamit tayo ng mga tamang katawagan o right terminologies.
Nag-join ako sa Roots of Health because meron ako mga kamag-anak na mga 50 years old pa lang. Kapwa ko mga pinsan ko and kapwa ko rin pinsan yung nakakabuntis sa kanila. Ang tanging ko lang magagawa is educate sila, spread ko yung knowledge na meron ako.
If you don't know things, you'll be in great danger. Having those knowledge can save lives.
We have an incredible team of really dedicated, passionate people, and I really love being on this journey with them.
Malaki yung naiaambag mo sa buhay nila na nababago yung kanilang mga maling paniniwala, at least nagiging tama.
It's respectful, it's treating people as equals, being honest with them. It's a good teaching method and it's a good, friendly, supportive clinical method.
Layunin po namin, mas maging bukas po ang isipan ng mga kabataan upang mas maayos po yung maging kinabukasan nila.
I dream that young people in the Philippines can grow up getting all of the support from their parents that they need, all of the schooling, all of the resources that they need to really grow into well-rounded, happy human beings.
So while our initial focus has been on Palawan, our organization is now working with an idea called Palawan Plus, and we're hoping that we can expand our programs and services throughout the Philippines so that we can see the gains that we've seen here in Palawan realized throughout the whole country. Ultimately, I want to see all women and girls with more agency and to see all babies wanted and planned.